This is Laura, and I am at California Pacific Medical Center in San Francisco, interviewing technologist Chris Ospina.
My name is Chris, nuclear medicine technologist, California Pacific Medical Center. I had about 8 patients on my schedule today. I became interested in medical imaging after enlisting in the United States Air Force. You see, I didn't have a choice to choose radiology. My ASVAB scores were pretty good, so it allowed me the opportunity to get diagnostic imaging. So I became an X-ray tech first in the military. I was originally a chemistry major at Northern Illinois University, so I found my calling in the military. So when I enlisted, they gave me radiology as a job. Also within radiology, there was opportunities for modalities. Once I learned what modalities I had to choose from, MRI, nuclear medicine, and ultrasound, naturally, as a chemistry major, I was curious as to what nuclear medicine was. So I was fascinated. And so from there, nuclear medicine, I went right into PET-CT. School was very challenging, going through the military program, because not only did we have to learn the fundamentals of radiology, but we also had to be primed for greater responsibilities in serving our great nation. So nonetheless, we still had to learn an advanced accelerated program compared to the civilian sector. Our program took about a year for radiology. In most programs on the outside, it's a little longer, probably about 2 years. But we still had to learn the didactic portions as well as be prepared to go abroad and defend our country. So my initial training in radiology was 14 weeks at Shepherd Air Force Base in Texas. And then from there, I got the option to choose my next base for clinicals. And I got to choose Travis Air Force Base, which is here in Fairfield, California. In that clinical site, I was able to learn about the different modalities. Nuclear medicine's program was also just as accelerated as the radiology program. They broke it down into 2 phases, a phase 1 and a phase 2. The phase 1 program was 5 months in Virginia at the Naval School of Health Sciences. There we learned radiopharmacy, physiology, anatomy, and some of the clinical procedures. However, we did not perform any patient care for 5 months. After the 5 months, I came back to Travis Air Force Base here in Fairfield, and I did 9 months of clinical work as well as advanced didactic curriculum. So they added that in there along with our clinical work. So we had an opportunity at this site to get into PET-CT because this particular site had just got a new PET-CT camera. So I was able to see the PET-CT department be built from the ground up. So a lot of my experience from PET-CT is through the military and how they brought it from the ground up. So it was very fascinating. And being a CT tech already, I understood a lot of the stuff that was going on. So I naturally transitioned into PET-CT very well. So in my clinical experience during my training, I learned a lot about myself. I learned to push myself to do things that I would not normally do with confidence and poise, because I never try to show my patients that that the competent level wasn't there. I always wanted them to be sure that they were in good hands. I feel it's important for a student in the clinical setting to find that balance, because not having the experience can hurt, but being able to pick up on life experience will help you in the long run. Help you pick up on the patient's nonverbals, help you with your bedside manners. These things I think are crucial, is paying attention to detail. It goes back to the paying attention to detail. Just like any day in a nuclear medicine department, the PET-CT department also starts off with quality control. The machine runs its own quality control at 6 in the morning. It's called a blank scan. Then we come in and we perform a scan to check the quality of the sinogram for the day. Then we also do QC on the CT portion, because we also perform diagnostic CT scans here. So with that being said, we have to check our crash cart first thing in the morning, because there could be a potential of a severe contrast reaction or other circumstances. After that, our patients check in at the radiology front desk. There we greet them We bring them back to our uptake rooms. In the uptake room, we interview them. We get a good clinical history, history of any prior imaging. Then we instruct them on the procedure. Basically what we do is we tell our patients that we are going to check their blood sugar levels. We're going to tell them what we're going to be doing every step of the way. We'll put an IV in. We'll inject them with the radioisotope. We'll let them know that the isotope needs to circulate for about 60 to 90 minutes. Once that circulation period is up, we have them use the restroom. After they use the restroom, we'll bring them into the PET-CT room. Here we'll perform the imaging. The imaging can take anywhere from 30 to 45 minutes, depending on if they have a diagnostic CT with it or it's just a plain old PET. A plain old PET can include from the top of the head to the thighs, or it can include from the top of the head all the way through the toes. That every situation is unique. There are things that can go on, and we have a schedule. We can do anywhere from 7 to 10 patients a day here in this department. Also, part of a regular workday is, as a technologist, we're concerned about radiation protection and safety. So as a technologist, you'll have to develop a technique that will allow you to perform the exam with the principles of alarm. All right, we don't have protection here per se. We can put tungsten shield around our FDG dose. We could, keep our distance from our patients. We can keep how much time we spend with our patients. But ultimately, the technologist will have to know how to develop a technique to still give that patient that attentive care, but also get the exam done in a timely fashion, because protection of radiation is important, especially for us and our other staff members. Having the ability to pay attention to detail, realizing that each patient's situation is unique, being able to identify potential issues, that's a key quality that a technologist should have. They should also be well knowledgeable on performing the exam so that they can comfort the patients, because bedside manner nowadays is very important. Patients have a choice nowadays, and having that good bedside manner, having that knowledge base, and being able to explain the test to the patient in layman's terms, I think is crucial. So those would be some key qualities that I think future technologists need to hit home on. If you asked me that question several years ago, I would say the toughest part several years ago would be explaining the exam to the patients and their family members. Today, that's not the problem, because we're so knowledgeable now about it as technologists that that's not the issue. I think the issue now is educating our fellow medical staff, nurses, doctors, ordering physicians, other healthcare workers on the procedure. The procedure is, it's pretty complicated in nature. There's a lot of patient prep. There's a lot of technical aspect to it, and I think it's the nuclear medicine technologist's responsibility to know those things and to be able to educate other healthcare professionals on the test, on preparing the patients properly, on explaining to them how long it's going to take, on the process as a whole.